I'm a pretty athletic fella, and I ran, and then probably 5, 6 years ago, anytime I did any kind of physical activity, if I golfed, it would swell up, so then I couldn't golf 2 days in a row. And you try everything. I've got every brace you could possibly want. Put the band around the kneecap, put the brace on that's got the hole in the middle, put the one that straps on. I tried all kinds of things to try to alleviate the pain. It was miserable. There's no other way to put it. It was miserable. Dr. DeGeer did a great job. He's been my doctor for a long, long time. He kind of watched my knee progress and get worse, and he said, well, I think it's time for you to go see an orthopedic surgeon. So I went to see Dr. Weiss.
Mr. Leahy, as I know him, we go way back.
I knew Dr. Weiss as Nick Weiss.
He was my junior high choir director and football coach.
I'm not surprised that he's become a successful orthopedic surgeon, and I'm not surprised that he's a top-notch adult, because that's the kind of kid he was.
What really got me interested in pursuing the custom knee was that in some of my patients with the off-the-shelf knee replacement, I was experiencing overhang. And overhang simply means that the prosthesis, the metal of the prosthesis, is hanging over the bone. In other words, it doesn't fit the patient perfectly.
So I asked him a few questions about, what were the benefits, and in terms of getting a custom fit knee. And what I heard from him was that, a perfect fit should mean less pain, less discomfort, faster recovery time.
I look at the custom knee as raising the bar, if you will. We'd like to move from good to excellent in our results, and I think this gives us a chance to do that.
Today, my knee feels totally different than it did before surgery. The difference is that it hurt all the time before anyway. After surgery, it hurt, but it never hurt any worse than it did pre-surgery, and it was getting better all the time.
He did outstanding. He was a model patient. He worked very hard in physical therapy, had an excellent attitude. I think that makes a huge difference.
They really cared about me getting better. They kept saying, what is it you can't do that you want to be able to do, and how can we help you get there? And I said, I'd really like to walk 9 holes 6 months out. I walked 18 holes 4 months out. I'm back to the things that I said I wanted to be able to do. To me, that's pretty remarkable.
There's absolutely no greater feeling in the world than seeing your patients after surgery doing so well. It's the most gratifying thing I can think of. And to see Mr. Leahy, a man who has given so much to all of his students, particularly me, for me to be able to give back to him a pain-free knee to get back to his lifestyle, there's just no better reward.
Good.